Welcome to LPN LaunchPad's review on special considerations in drug therapy, a critical area of nursing knowledge that requires careful attention to detail and an understanding of medication risks across various patient populations. The content will explore high-risk medications, specific patient considerations, and strategies to ensure therapeutic safety in clinical practice. The key objectives for today's presentation on drug therapy considerations include developing competency in recognizing medications with high potential for harm, understanding how to adapt pharmaceutical interventions for specific patient populations with unique needs, and implementing strategies to ensure safety and efficacy in medication administration. These skills form the foundation of competent medication management in nursing practice and are frequently assessed on licensing examinations. High alert medications represent a category of drugs with significant potential to cause serious harm if misused or administered incorrectly. These medications warrant special attention in clinical settings as errors in dosing, preparation, or administration can result in life-threatening consequences for patients. The nurse must approach these medications with heightened vigilance and adhere strictly to established protocols to prevent adverse outcomes that could lead to permanent injury or death. Specific examples of high alert medications include insulin administration, which requires precise dosing, as incorrect amounts can rapidly precipitate hypoglycemia, a potentially fatal condition. Anticoagulants such as warfarin and heparin demand careful monitoring through laboratory values like INR and APTT, since excessive anticoagulation may lead to internal bleeding that can be difficult to control. Chemotherapy agents are inherently toxic to healthy tissues, along with cancerous cells, requiring specialized handling procedures and administration techniques to prevent severe adverse effects, both in patients and healthcare workers who handle these substances. The PINCH acronym is a critical memory tool for identifying high alert medications requiring special administration precautions. P is for potassium. Intravenous potassium administration errors can trigger lethal cardiac arrhythmias if administered too rapidly or in excessive concentrations. I represents insulin, where even minor dosing errors may result in severe, potentially fatal hypoglycemia, requiring immediate intervention. N stands for narcotics or opioids, which carry the risk of respiratory depression if overdosed, necessitating careful titration and monitoring. C indicates chemotherapy agents that are caustic to tissues and cause immunosuppression, requiring specialized handling. Finally, H denotes heparin and other anticoagulants that present significant hemorrhage risks if not precisely dosed and monitored throughout therapy. When managing high alert medications, nursing protocols emphasize several critical safety measures frequently appearing on licensure examinations. The nurse must implement double-checking procedures with another qualified nurse before administering these high-risk medications to reduce the possibility of error. Continuous monitoring of relevant laboratory values, including the international normalized ratio for warfarin therapy, activated partial thromboplastin time for heparin administration, and blood glucose measurements for patients receiving insulin, is essential. Small mistakes with these medications can rapidly lead to life-threatening situations, requiring nurses to demonstrate competence in recognizing both the risks and appropriate safety protocols for high alert medications. Moving to another important medication safety consideration, black box warnings represent the Food and Drug Administration's most serious caution for medications associated with significant or potentially life-threatening adverse effects. These warnings are visually distinctive and printed within a prominent black box on the drug label and package insert to ensure healthcare providers notice these critical alerts. A black box warning indicates substantial evidence of serious hazards that may not be immediately evident without careful monitoring, and recognition of these warnings constitutes an essential aspect of medication safety knowledge frequently assessed on licensing examinations. Several commonly prescribed medication classes carry black box warnings that require special nursing consideration. Antidepressants, particularly selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors, carry warnings regarding increased risk of suicidal thoughts and behaviors, especially in children and young adults during the initial treatment period. Fluoroquinolone antibiotics, such as levofloxacin, have warnings related to tendon rupture, peripheral nerve damage, and central nervous system effects that may be permanent. Isotretinoin, marketed as Accutane, carries a Category X pregnancy warning due to its highly teratogenic properties, necessitating participation in the specialized iPledge program that ensures appropriate contraception use and pregnancy monitoring throughout treatment. When administering medications with black box warnings, Nurses are responsible for several critical interventions, such as thorough patient education about the warning in clear, understandable language, so patients can recognize and report early warning signs of severe effects. The nurse must implement appropriate monitoring protocols tailored to the specific risks of each medication, documenting findings according to established standards. For high-risk medicines such as chemotherapy agents or isotretinoin, informed consent verification may be required before administration. Black box warnings indicate high risk and necessitate comprehensive patient understanding and appropriate follow-up care to prevent serious complications. Pediatric considerations in drug therapy and dosage calculation methods differ significantly from adult protocols, typically utilizing weight-based formulas measured in milligrams per kilogram or calculations based on body surface area. These specialized calculations accommodate the physiological reality that children possess immature liver and kidney function, resulting in slower metabolism and excretion of medications, which creates higher toxicity risks even with proportionally adjusted dosing. Nurses must double-check pediatric dose calculations and verify that weight measurements are recorded in kilograms rather than pounds to prevent potentially dangerous conversion errors. Additional pediatric medication considerations include developmental factors that create unique challenges in drug administration. Medication taste and formulation significantly impact compliance, often necessitating liquid formulations for younger children who cannot swallow tablets. The risk of choking represents a serious concern when administering large pills to pediatric patients, requiring alternative delivery methods. Children typically experience narrower therapeutic windows for many medications, making dosing more error-prone than in adult populations. Standard error scenarios encountered in practice include acetaminophen overdose, resulting from confusion between concentrated infant drops and less concentrated children's liquid formulations, and critical weight conversion errors when pounds are used instead of kilograms in dose calculations. There is an increased risk for pregnant women and the fetus. Certain medications present significant teratogenic risks, particularly during the critical first trimester when major organ systems are developing. The nurse must recognize medicines that should be avoided during pregnancy, including isotretinoin, Accutane, which causes severe craniofacial and neural tube defects, angiotensin-converting enzyme inhibitors, which can cause fetal kidney damage, particularly in the second and third trimesters, and warfarin, which carries a Category D rating due to the risk of fetal bleeding disorders and developmental abnormalities. Nursing assessment of pregnancy status before administering these medications represents a critical safety measure frequently evaluated on licensure examinations. Continuing with considerations for lactating patients, the nurse must recognize that certain medications can be excreted into breast milk and potentially affect the nursing infant. Medications requiring caution or avoidance during breastfeeding include lithium, which presents a risk of infant toxicity due to immature renal function and potential for accumulation, and tetracycline antibiotics, which can affect dental and bone development in the nursing infant. The assessment of breastfeeding status and knowledge of medications contraindicated during lactation represents an essential aspect of maternal-child nursing care, requiring nurses to balance maternal treatment needs with infant safety considerations. The Food and Drug Administration's pregnancy category system provides a framework for evaluating medication safety during pregnancy. However, nurses should be aware that this system continues to be updated with more detailed information. Category A medications have demonstrated safety in human studies, while Category B indicates no known risk in humans, though animal studies may show effects. Category C designates medications where risk cannot be ruled out due to insufficient human studies. At the same time, Category D includes medications with positive evidence of risk, where benefits may still outweigh risks in specific clinical scenarios. Category X medications are contraindicated in pregnancy due to demonstrated fetal risks that outweigh any potential benefit. It is essential to recognize that Category X medications must never be used during pregnancy, and that pregnancy status must continually be assessed before administering known teratogens. In older adult patients, significant physiological changes affect pharmacokinetics in geriatric populations. Age-related decreases in renal and hepatic function result in a slower metabolism and excretion of medications, creating an increased risk for toxicity even at standard dosages. Reduced gastrointestinal motility and decreased splanchnic blood flow can alter medication absorption patterns, further complicating therapeutic management. Many older adults present with multiple comorbid conditions, requiring careful dose adjustments to prevent adverse events while maintaining therapeutic efficacy across concurrent disease processes. Further examining geriatric pharmacology, polypharmacy presents significant challenges as multiple medication regimens increase the risk of drug-drug interactions and compound potential side effects. Clinical best practices for geriatric patients emphasize the principle of start low, go slow when initiating sedatives, antihypertensives, and opioid medications to minimize adverse effects. The Beers criteria is an evidence-based tool for identifying potentially inappropriate medications for older adults based on risk-benefit analysis. Checking creatinine clearance values, rather than serum creatinine alone when administering drugs, excreted by the renal system to older adults is essential. This calculation more accurately reflects actual kidney function in the geriatric population. Reviewing the essential concepts addressed in this presentation, high alert drugs identified through the PINCH acronym require double-checking procedures and close laboratory monitoring to ensure patient safety. Medications with black box warnings indicate serious or life-threatening potential adverse effects that necessitate thorough patient teaching and vigilant monitoring. Pediatric medication administration involves weight-based dosing that must account for immature organ systems, creating a high risk for calculation errors. Pregnancy considerations mandate avoiding Category X medications and monitoring for potential transfer of medications through breast milk to nursing infants. Finally, medication management for older adults must address polypharmacy concerns and declining organ function through careful dosage adjustment, typically starting with lower doses and titrating slowly while monitoring for adverse effects. Now let's review with a practice question. Which medication falls under the PINCH acronym for high alert drugs? Option A, metformin. Option B, hydrochlorothiazide. Option C, heparin. Option D, omeprazole. Consider the components of the PINCH acronym when selecting the correct answer. The correct answer is C, heparin. Heparin is classified as an anticoagulant, and the H in the PINCH acronym stands for high alert medications. This classification is warranted because heparin carries a significant risk of bleeding complications and requires additional safety precautions, including laboratory monitoring of clotting times and careful dose calculation. The other medications listed, metformin, hydrochlorothiazide, and omeprazole, while having their side effect profiles, do not fall into the high alert categories represented by the PINCH acronym. Moving on to our next review question, which focuses on pediatric medications, which statement by the mother of a 2-year-old indicates a correct understanding of pediatric dosing? Option A, I'll give half of my adult tablet since he's small. Option B, I'll convert his weight to pounds for the nurse. Option C, the dose should be based on his weight in kilograms. Option D, I'll use any household spoon for measuring liquid meds. Think about safe pediatric medication practices when considering the correct response. The correct answer is C. The dose should be based on his weight in kilograms. Pediatric medication dosing typically requires calculations based on milligrams per kilogram of body weight, necessitating accurate weight measurement in kilograms rather than pounds. The other options represent common misconceptions that can lead to medication errors. Splitting adult tablets does not account for differences in metabolism and elimination. Weight should be converted to kilograms rather than pounds for dosing calculations, and household spoons vary significantly in volume, potentially causing dangerous inaccuracies in dosing liquid medications for children. For the final review question, consider geriatric pharmacology. An elderly patient with reduced renal function has been prescribed a new antibiotic. Which principle is most important to prevent toxicity? Option A, using a loading dose to achieve therapeutic levels faster. Option B, administering a higher dose due to decreased absorption. Option C, start at a low dose and monitor kidney function. Option D, stopping all other meds to avoid interactions. Consider the physiological changes that occur with aging when selecting the appropriate response. The correct answer is C, starting at a low dose and monitoring kidney function. Older adults with reduced renal function typically require the start low, go slow approach to dosing, particularly with medications eliminated through renal pathways. Close monitoring of kidney function helps prevent accumulation and toxicity while allowing for dose adjustments based on individual response. The incorrect options represent approaches that could potentially increase rather than decrease toxicity risk. Loading doses may cause immediate toxicity. Higher doses are rarely needed due to reduced absorption, and abruptly stopping all other medications creates risks of therapeutic failure for chronic conditions. Concluding this presentation on special considerations in drug therapy, several key principles have been addressed that will enhance medication safety across diverse patient populations. The nurse must remain vigilant when administering high alert medications, understand the implications of black box warnings, apply appropriate dosing adjustments for pediatric and geriatric patients, and recognize contraindications during pregnancy and lactation. Questions can be placed in the comments section below, and LPN LaunchPad will respond with detailed answers. Please remember to like this video, subscribe to the channel, and share your thoughts in the comments to help support the LPN Launchpad project. Hey there, this is Brian, the creator of LPN Launchpad. I aim to give every student a fair review for the NCLEX for free using YouTube videos that can be watched or listened to without losing value. It may be free, but it is still valuable. If you find these reviews helpful, help me keep this project alive by hitting the like and subscribe buttons and continuing to watch my videos. Also, check out the free ChatGPT NCLEX review quizzes I have made to accompany these videos. A link is in the description or search for LPN Launchpad in the Explore GPT box. This review has been an LPN Launchpad production. We care for our future nurses by freely sharing knowledge.